You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your Physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
All right, can everyone hear me?
Yes, we can.
All right. That sounds good. Well, hey everyone, my name is Nam Nguyen. I'm a third year physical medicine and rehab resident here at UT Austin. Thank you for tuning in on a Sunday night. And thanks for just being so flexible during these really kind of ever-changing times. But we really wish we could meet you all in person, but we really hope that this presentation allows you a little glimpse into this program in Austin. So we'll go ahead and get started. So we're located in Austin, Texas, the capital of Texas, and just this really great city for great live music, great food, great nightlife, nature. It's one of the fastest growing cities in the United States, and we owe that a lot to the tech industry that's booming in Austin. But yeah, Austin is just a great place to live with never a dull moment. To touch on some of the core faculty, we have our program director, Dr. Deborah Bergfeld, here on the left. She was the assistant program director for many years up until she stood up to the program director role this year. And as program director, she's not kind of someone who just kind of hides in the background. She's going to be someone who you'll interact with on a very frequent basis. She leads our continuity clinic, which we do weekly. And she's also one of our inpatient rehab attendings. So it's really nice to have that one-on-one kind of direct contact with your program director on such a frequent basis. We have our former program director, Dr. Christopher Garrison. So he was the gentleman who kind of led this program from its initiation in 2012 and really built this program from the ground up. He drew on his experience from being program director formerly at Baylor Dallas to help create this program and has really made this program grow kind of similar to the city of Austin. We're really thankful to have him. We have our associate program director, Dr. Kristen Wong, who runs the consult service, and our wonderful program coordinator, Miss Debbie LeBlanc. So all really instrumental people in our residency program. So we have a total of 6 residents in our program. We're an advanced program, so we start after you complete your PGY1 training in either transitional year or preliminary internal medicine or surgery year. We have 2 residents each year, and something to highlight is that the majority of the class is actually from outside of Texas. So I think there's this kind of assumption that all Texas programs lean heavily towards Texas residents and people from Texas medical schools. But we just want to show you kind of the residents where we come from, just to highlight that we welcome all people from outside of Texas. I think Dr. Ahmed and I are the only 2 native Texans, but we have Anthony Recibo from Chicago, Gabby from California and Seattle, Eddie from California, who did his medical school in Oregon, and then Lindsay Steinbeck, who is an Ohio native. So welcome all people to apply to our program. So here's a sample rotation schedule, which we'll go a little bit more in depth on, but each block will be 2 months. So starting your PGY2 year, you'll do 2 months of inpatient rehab, then 2 months of consults, go back to inpatient rehab, 2 months of outpatient rehab, 2 months of interventional pain, and then 2 months of outpatient MSK. And this will be a little bit different if you're the other resident, but overall kind of the same rotations. Starting your PGY3, you have 2 months of selective period, which we'll go into further detail a little bit later. 2 months of pediatrics, 2 months outpatient MSK, 2 months back to inpatient rehab, 2 months outpatient rehab, and then back to inpatient rehab. And then your final year of residency here, you do 2 months of interventional pain, 2 months on the inpatient side as a senior, pediatrics, consults, back to inpatient rehab, and then ending on a selective. So I know this is kind of a lot of information to put on the slide, but just general things we want to highlight. One is that our inpatient rehab experience is split pretty evenly among your 3 years here. And one of the reasons we decided to do that is just because when you do your outpatient rotations, outpatient rehab, when you're doing EMGs or in the interventional pain realm, we feel like you come back to your inpatient months with these kind of other aspects of knowledge that really help you kind of look at things from a different perspective when you come back to inpatient rehab. So you get a lot of this kind of interweaving of education throughout your 3 years here. And additionally, something to highlight is that we have kind of that early elective period starting PGY 3-year just to allow you to explore other areas of interest and kind of assist you if you are planning on applying to a competitive fellowship. So we'll start off with our inpatient rehab hospital. This is Central Texas Rehab. It's a 50-bed hospital, which you'll do 4 months each year in your 3 years here. You'll be on an academic service consisting of both a senior and a junior. So you'll always have someone to kind of bounce ideas off of. And when you're first starting residency, you can lean a little bit onto your senior. And then after your years here, you'll be able to kind of fill that senior role and help spread that knowledge to your junior resident. We see a wide variety of pathology, pretty classic bread and butter PM&R consisting of stroke, SCI, TBI, polytrauma, amputation, and cardiac and pulmonary rehab. And your service is going to be a mix of patients. So it won't just be a dedicated month of SCI. It'll be kind of a mix of a lot of patients that we listed earlier. It'll be about 20 to 25 patients split among you and your co-resident, although this is kind of in flux with however referrals are made. And we also co-manage with internal medicine, kind of like the other programs I've mentioned. We learn through a lot of ways at Central Texas Rehab, through leading team conference, through doing professor rounds with Dr. Garrison, the former program director. He likes to do a lot of chalk talks, learning through leading bowel and bladder rounds, therapy rounds, P&O review, wound care, and having the opportunity to do electrodiagnostic studies and peripheral joint injections at Central Texas Rehab as well. Next, we have our consults rotation. This is at Del Seaton Medical Center in downtown Austin. It's a level 1 trauma center, which captures a wide pathology in Central Texas. So you'll do a total of 4 months split among your PGY2 and your PGY4 years. You work with our associate program director, Dr. Wong, who's a fantastic mentor. You get a lot of one-on-one mentorship with her, and you get to really master your physical examination skills as well. So this is one of the rotations you start off as a PGY2, and it really just kind of builds that foundation for the rest of your residency. And it's cool to work alongside other specialties. We work primarily with the surgical ICU team, the burn team, internal medicine, neurology as well. So getting to see some of the other residents and kind of learning their perspective on diseases of the same pathology. So Central Texas Rehab, the inpatient rotation and consults are the 2 rotations which we're going to take call. For our inpatient, you're going to work 1 weekend a month, which averages 4 weekends a year, where you cover on the weekend from Friday evening to Monday morning. And there you're going to cover the new admissions that come in and cover the follow-ups for the academic service, while your attending covers the non-academic service patients. And you'll do home call, so this will be you'll receive all the pages for all the patients in the hospital for the weekend. And then during the weekdays from Monday evening to Friday morning, you'll also cover 1 week, totaling about 4 weeks a year. On consults, you do assist in the weekend call, but you don't have to do the week call. So helping that 1 weekend a month as well. So overall, the total for each year is 4 weeks of home call with 4 to 6 weekends of call, depending on if you have consults, leaving you, quite a few weekends for your leisure, for your learning. And the reason why we do home call is just to develop practical and real world experiences. The overwhelming majority of inpatient rehab hospitals do home call. So this allows you the opportunity to learn how to perform in-depth, chart reviews from home, accurate patient assessments when you're discussing with the nurse, how to work smarter. And just because our inpatient months tend to be the busier months, it allows you for some time to breathe at home. So Continuity Clinic is a unique aspect of our program as well. We work a half day a week with our program director, Dr. Bergfeld, and you see a wide variety of pathology as you get referrals from all over the place, from primary care physicians, from neurology, from ortho, and follow-ups from the inpatient rehab hospital as well. 2 things that's cool for is that 1, you get that longitudinal learning. So I've actually seen a patient on consults, followed them at their inpatient rehab stay, and then out in Continuity Clinic as well. So it's really wonderful to see the patients kind of progress throughout their time. And additionally, the cool thing about the wide variety of referrals is you just get a ton of pathology in Continuity Clinic, and it's not just kind of one type of pathology you see. It's really common to have a Continuity Clinic that will be made up of, post-stroke patients, but then the next is low back pain, the next is amputee, and then the next is for spasticity. So just a lot of different types of learning in your clinic. And also this allows you to practice kind of for your future practice as well, as, these are your patients. And so you get a lot of autonomy with that. So you get to answer kind of inbox questions, learn how to do refills of stuff, follow up on imaging in labs, learn how to place referrals to other specialties. So just kind of practicing the skills that you would learn kind of out in practice as well. And then we have our selective period. This is a total of 4 months that's split among our PGY 3 and 4 years. And this is purely based on your personal and career interests. So previous residents have done a variety of rotations spanning from cancer rehab to sports MSK, pain management, pediatric pain, women's health, and inpatient rehab. And you can also do these at any institution inside Texas and outside as well. We really are proud of this selective period because it allows the residents to, seize this opportunity not only to learn what they're interested in, but a lot of residents who are interested in fellowship use it almost kind of as an away rotation to learn a little bit more about other programs and network further as well. But you also have the option to stay local and create hybrid rotations for your learning as well. We have our pediatrics rotation at Dell Children's Medical Center. This is the region's only level 1 trauma center, where you'll do a total of 4 months split among your PGY 3 and 4 years. This is a really interesting rotation in that it's a blend of inpatient consults and outpatient, and there's a really robust amount of multidisciplinary clinics that you see in the pediatric side, including concussion, spinal bifida, spasticity, hand clinic. And then on the peds rehab side, you'll have the opportunity to do electrodiagnostic studies and Botox injections as well. And then just to touch on some of the other rotations, since we're running kind of low on time, but we have outpatient MSK, 4 months split among PGY 2 and 3. We work with some amazing private practice PM&R doctors, including Dr. Mackay and Dr. Bunch, and they work at Texas Orthopedics. So a really unique opportunity in getting to see kind of the private practice aspect or the private practice side of PM&R and kind of the differences between that and academic medicine. And we also have our pain management rotation with Dr. Foreman. A unique aspect is that it's done early on in our PGY 2 year as well as PGY 4. And you just get to see clinic, help perform interventional spine procedures and do peripheral joint injections as well. And then our last rotation, outpatient rehabilitation, a total of 4 months split among your PGY 2 and 3 years. And this is a real wide variety of PM&R clinics. So you'll do electrodiagnostic studies and learn how to write up the reports for that, do Botox clinic for spasticity, as well as a wide variety of neuromuscular clinic, which also entails ALS clinic, movement disorder clinic, amputee clinic, and spinal cord injury clinic as well. So learning opportunities, we do our didactics on Wednesday mornings from 7 a.m. to noon. This consists of a wide variety of things from resident-led lectures to faculty-led lectures, field trips. We've visited sites like neurorestorative in the past too, going through cases, having guest speakers from different companies and kind of different disciplines come to speak with us, doing ultrasound workshops as shown on the right, as well as anatomy labs and procedural labs. Just a few weeks ago, we had the opportunity to revisit cadaver lab with one of our really awesome hand surgeons, and he dissected out the brachial plexus, and we looked at the pulleys of the hand, which was really cool. And one of our ultrasound attendings, Dr. Hazelhorst, a former resident of the program, actually went over through ultrasound guided procedures, and we were able to practice that in the cadaver lab as well. And then lastly, we have board review, just going through board questions and practice kind of oral board review as well. Additionally, we have journal club every last Thursday of the month where we discuss 3 articles. Previously, it was over dinner prior to COVID, and we're really eagerly waiting for that to come back, but we review both current and essential PM&R literature. And just, it's really awesome to see how the faculty really interprets these studies and their practical takeaways, and just learning how to really appraise articles as we'll be lifelong learners following our time here at UT Austin. And then our previous residents have matched to a real wide variety of competitive fellowships, not only in a large amount of kind of different specialties, but also all over the United States. We've had people do, pediatric rehab, pain management, sports medicine, neuromuscular medicine, pediatric pain, cancer rehabilitation as well, all at really amazing institutions as we can see below. So We really think it's kind of a product of not only the great foundation that our program builds through its core rotations, but also that selective opportunity too. And then we just have a really
And
awesome
just about 5 minutes left to let you know.
Okay, sounds good. And we have a really awesome resident community. I know one of my concerns when I was in your shoes when I was applying was what's a small program like, and will I be able to find my niche? And honestly, everyone here is really great. You get a lot of one-on-one mentorship with your attendings and get to know them even on a more personal level. And so they're not kind of these scary attendings, but really great people who are really happy to watch you grow. And then we have our residents. We try to be as close as we can despite COVID times, but just a really great network to lean on. So overall program highlights, we have an extensive variety of hands-on educational and clinical experiences in the inpatient and outpatient settings. We have really amazing faculty who are just really invested in your education and training people who we will call future colleagues down the line. We do have free food and free parking at all of our sites, which is a huge perk. Competitive fellowships and matches, which we've seen before. And even if you don't do a fellowship, we've had people have really great job opportunities following their time here. And the world is your oyster. Not only do you have the opportunity to during your selective period to explore what you like, but as you progress, you have a little bit of, you have kind of more say in what you want in your rotation. So helping kind of guide your outpatient experiences tailored to what you like. We have our awesome resident group who becomes kind of an extension of your family here. And then just living in the great city of Austin, just again, to highlight amazing nightlife, amazing food, always something to do in this kind of ever-growing city. So I think that's all that we have. If you have any questions, you can talk to our program coordinator, Debbie LeBlanc. That's her email right there. These are our chief residents' emails, and then I'll place my email as well in the chat section. But thank you all for tuning in, and let me know if you have any questions. Let's see, I'll check the chat box right now.
We've got about 2.5 minutes for questions.
Okay, sounds good. Let's see, how open is UT Austin to non-US IMGs? I don't see any IMGs on the resident roster. Has UT interviewed? I believe they have interviewed. I was not a part of the process when I was a PGY2, but definitely open to it. Let's see, thank you for the presentation. Do you find that your resident salaries are keeping up with the growing cost? So yeah, our resident salary is actually quite good. Starting from your PGY2 year, it's about $62,500, and cost of living in Austin is not that high. Although we're a really fast growing city, cost of living hasn't been as bad. I did my prelim year in Chicago, and that was definitely a higher cost of living for a lower salary. So here at Austin, it's definitely doable. And then, yeah, $62,500 to start, and then about $2,500 raise each year. How friendly is UT Austin for residents with families and kids? Very, very, very friendly. So our previous chief resident, she had a kid, and our 2 incoming residents, the ones who will be starting this next year, both have, really established families. So, we, at times prior to COVID, had a lot of get-togethers with the faculty as well and their families to getting to know them as well. So really open to that. Are there opportunities available for OMT usage? I actually haven't seen this at UT Austin, but again, during that selective period, something you can explore and something that you can kind of advocate for. One of our previous residents was really interested in adaptive sports. And so we didn't really have any adaptive sports opportunities. So she really started it up from the ground up and kind of made that part of her clinic opportunity. And that really served her well when she did her fellowship interviews. She actually trained at Shirley Ryan Ability Lab for her sports medicine fellowship. So although I don't know any current opportunities for OMT usage, I think that's something that we could definitely foster here. And then can you speak more about the diversity and inclusion efforts? That's a great thing. So we're actually going to be talking at our diversity and inclusion kind of fair for the Dell Medical School, which we're really closely involved with. Again, we are really open to any kind of any medical students and any applicants from any backgrounds. We have a really open faculty and really just foster this environment of all residents. So happy to invite anyone. Let's see. And I think I just hit my last minute.
Yeah, thank you so much. That was another excellent presentation, and we will move forward now. Feel free to continue to discuss in the chat